Uh, we had in day one a number of policymakers talking about different aspects of healthcare and how policies regarding healthcare are being formulated at different levels. We had more than 20 hospital participating in multiple panel discussions, deliberating on different aspects of healthcare. Today also we had a panel discussion in the morning where the discussion was on prevention of infection, especially in these times of pandemic. Now we have a very interesting session by one of the leading proponents of Government of India's health policy. Before I hand it over to the person, let me briefly introduce him to the 300 plus audience who are present here. He is an IRS officer of the 2006 batch and is currently posted as Director IT at the National Digital Health Mission of National Health Authority. Prior to this current role, he was posted as a additional commissioner of income tax, where he was responsible for the implementation of CAS, or the Computer Assisted Scrutiny Selection of Income Tax Department. He has also been a member of the expert panel for centralized technology vertical project of the CBI, of Central Bureau of Investigation. Uh, and he holds a BTech in computer science from IIT Kanpur. And he also has authored a book called Mathematics for Learning Physics. Without any further ado, let's welcome Shri Abhishek Kumar for his session today. Uh, we are proud and honored to have Shri Kumar in the session, and now I'd like to hand it over to him for his speech. Thank you.
Thank you. As we know, Government of India launched NDHM, National Digital Health Mission, last year on 15th August, and it is a very important project with the potential to revolutionize entire healthcare sector in the sense that whatever gaps are there between demand and supply side, and whatever bottlenecks are there in discovering the best possible health and wellness services, all these issues can be addressed with complete implementation of National Digital Health Mission. Currently, this project is going on in pilot mode in 6 union territories, and various building blocks of National Digital Health Mission have already been launched. Although their use currently is limited to various stakeholders in 6 union territories. So, to understand this project, National Digital Health Mission, we need to understand few basic things. As we know, in the digital world, uh, there are disparate systems, and unless we define common identities and common protocol, we end up creating islands of excellence or islands of convenience, but without any communication channel among them. And entire healthcare ecosystem can leverage its best potential only if we are able to bridge this gap and establish a communication channel among different stakeholders. So how do we establish this communication channel? There are few basic points. First is that all the participating entities need to have a common identity across ecosystem. Like suppose somebody visits a hospital today, so the person is assigned one local ID which is normally called UHID. So suppose some person visited a hospital X and some local ID was assigned. Next day, the person may visit hospital Y and some other local ID will be assigned. So these two systems cannot make out while talking to each other that it is the same person about which they are talking. So if instead of local hospital software, these IDs are assigned by a centralized system, in that case, different hospitals and their softwares will be able to find out that it is the same person, and their corresponding data records can be linked to the advantage of that person, because as we know, for medical treatment, doctors or other healthcare professionals or hospitals need to have longitudinal health record of the individual. So that is the first part, that we need to create unique identities or common identities across the ecosystem. So in NDHM, we are building various registries. So let us say health ID for individuals, uh, ID for healthcare professionals as part of healthcare professional registry, then health facility registry, which establishes identities for facilities. So that is the way common set of identities can be established. Now, whether identification of entities or common identification is in itself sufficient to break these silos? No, that is just one part. Next part is that various entities should be talking in common language. So if we take an analogy to communication between two individuals can have effective communication only if their identities are known to each other and they are speaking in a common language which is understood by both of them, right? So in the same way, apart from establishing identities, we need to establish standards or protocols across the ecosystem, and these common standards and protocols make sure that various systems are able to talk in the same language. So it requires defining of standards and specifications like health data standards. As we know, during a hospital visit, various types of records are generated like prescription, discharge summary, uh, lab and imaging reports, clinical notes, etc. So a common data template or format needs to be defined. Only after that, various systems will be able to talk to each other. So this is second important part. And in NDHM, we are already defining various standards, and the basic information about all these aspects is available on the website of NDHM, which is ndhm.gov.in. Moving to next part, whatever I explained till now, it is just about various digital entities and digital interventions which may not probably make much sense to a wide class of people who as such are not directly connected with information technology. The end objective is to make health and wellness services available in the best possible manner to the citizens of this country. So in the beginning, I talked about bridging the gap between demand and supply side. What is the meaning of that? Suppose I, as an individual, wish to avail services of any doctor. The best possible way for me is that through a mobile application, I should be able to find out various choices available to me depending upon the need or the assistance I am looking for. So, after implementation of NDHM, discoverability of various types of healthcare services will be very smooth and convenient. It will be very handy, and through click on a mobile screen, one will be able to find out best possible healthcare services. Not only that, teleconsultation can be availed, and the other health and wellness services can be availed. Coming to next part, we need to understand few basic point about NDHM, because we have seen that whenever it comes to any digital project, various kinds of concerns are raised related to privacy, data security, and all those things. We need to understand that NDHM doesn't seek to create any new kind of HMIS system or digital system which will replace any software. NDHM is about creating a digital layer on the top of various existing applications, which just ensures interoperability. That's all. From the healthcare perspective as well, NDHM is not about reinventing the wheel. Just like today we visit doctors and we share our medical records and receive consultation, in the same way it will happen even after NDHM. No centralized repository of data is sought to be created in NDHM. Data will remain as it is. So suppose some data is being maintained in the cloud or data center of some hospital today in digital format, it will continue to be maintained in the same manner. There is not going to be any change. Only NDHM will be managing consent management part, and indexage will be maintained in NDHM central system. No health records will be maintained in NDHM central system. And data principal, that means the patient or the citizen, will continue to remain owner of data. Just like today, any person shares any data with a hospital or doctor as per their own wish, in the same manner it will be can be shared only with the consent of the individual. So suppose how the user journey changes with NDHM. Suppose I wish to avail services of NDHM, so I can go to uh, any consumer or patient facing application. I can search for doctor, and let us say I book an appointment. So the doctor at the other end may request for my medical records. Once the doctor makes the request will land on my mobile screen for providing consent. Now it is up to me to decide whether to provide consent at all or not. Secondly, I can also decide what will be the time period for which the records will be accessible to the doctor. And I can also decide at granular level that out of, let us say, 20 records available in my PHR application, personal health record application, or consumer facing application, what are the records I wish to grant access to. So basically, privacy by design and data principle or patient being in control of data, they are the basic principles of NDHM, and there is no need to have any concern related to data privacy or data security. Secondly, participation in NDHM is voluntary, and any individual will be required to participate only as per their willingness. So it is very important for success of NDHM that stakeholders see value in adopting NDHM, and only then we will be able to realize true potential of NDHM. The way things are going on, we are quite hopeful that people and especially citizens of this country will see benefit, people will adopt it, and that way NDHM will be able to revolutionize entire digital healthcare sector, just like UPI revolutionized finance sector. Thank you.
Thanks a lot, Mr. Kumar, for this. So, we talked about the NDHM, and some very important information came out from Shri Kumar's speech. That one important thing is that participation in NDHM will be voluntary. So, it is very critical that all the stakeholders who will participate it see value in it. He emphasized on the importance of setting standards, protocols, and the templates for that. Then ensuring these mobile application whereby choices are available to the stakeholders in terms of making health and wellness services available to them. One major concern for many of the stakeholders will be privacy and cybersecurity concerns. Shri Kumar again reinforced that there will be no central repository of the data, while NDHM is primarily managing only the consent management part. So the cybersecurity and privacy part has been taken care of. So I'm sure what the brief message Shri Kumar has given will be very beneficial for the 300 plus audience who are witnessing this live, and they will be further able to propagate this through all the stakeholders who are likely to come into the NDHM system. With that, I would like to again thank Shri Kumar for his enlightening session and informing us about the NDHM details, and wishing you are having a very great day. Thanks a lot, sir.
Thank you.